In recent months, the price of eggs has soared with such intensity that what was once a humble and essential ingredient is now beginning to resemble a luxury item, one that may soon feature more prominently in financial columns than in culinary guides. What we are witnessing is not just a temporary bump in cost. It is a confluence of global pressures that may permanently alter the place of eggs in our diets. From supply chain strain to avian disease outbreaks, the conditions are forming a perfect storm, and the implications for consumers are more serious than they might appear at first glance. The surge in egg prices is partly due to inflation and the broader rise in the cost of raw materials that has affected nearly every aspect of the food industry. But compounding the issue is a widespread outbreak of avian influenza, particularly in the United States and parts of Europe, where authorities have had to cull millions of chickens to contain the virus. These losses have drastically reduced egg supply, and with it, market availability. Meanwhile, demand remains high, especially during seasonal peaks like Easter, when traditional recipes rely heavily on eggs. This imbalance is pushing prices up to the point where eggs are beginning to rival premium proteins in terms of affordability. This price dynamic carries worrying social implications. Eggs have long been a cornerstone of nutrition for low-income households, a reliable and accessible source of protein. They require little preparation, are highly versatile, and offer a wealth of nutrients. But with costs climbing steadily, many families are beginning to treat eggs as an occasional indulgence rather than a dietary staple. What used to be a daily breakfast or an easy dinner solution is now the subject of budgeting decisions. This hits vulnerable populations the hardest and exacerbates existing inequalities in access to healthy food. On a nutritional level, eggs remain an excellent food, but this does not shield them from criticism. For decades, debates around dietary cholesterol cast a shadow over egg consumption, and while much of the medical consensus has shifted toward recognizing eggs as generally beneficial, they are not without risks. The yolk, though rich in vitamins A and D and healthy fats, is also high in cholesterol. Excessive intake, particularly when combined with a diet already high in saturated fat, may increase cardiovascular risk in certain individuals. Furthermore, improperly stored or undercooked eggs continue to pose a risk of salmonella, a serious bacterial infection that disproportionately affects children, the elderly, and immunocompromised individuals. To mitigate this, the food industry increasingly uses pasteurized egg products, especially in food service, but these alternatives are less common in households and lack the culinary appeal of fresh eggs. The romanticism surrounding eggs, celebrated in everything from elaborate brunch dishes to historical anecdotes like Columbus's symbolic egg demonstration, cannot distract us from the hard economic and health realities now surrounding this food. The versatility and simplicity of eggs have made them a staple across cultures, yet we must now reassess how we access and consume them. If price trends continue and production remains unstable, eggs could become a case study in how global fragility turns basic nourishment into a privilege. Looking ahead, the path forward requires vigilance. Consumers should be cautious not only of the rising prices, but also of the food safety concerns that may intensify if supply chains are further disrupted. Governments and industry leaders must take coordinated steps to ensure that eggs remain both safe and affordable, especially for the most nutritionally vulnerable segments of the population. If not, the egg may soon lose its place as a universal food and become instead a marker of growing inequality in our food systems.